This is a patient who I would probably see every 3 weeks while he's getting chemotherapy. I would give him 6 cycles of chemotherapy, so we would be seeing each other quite a bit right at the outset of their treatment. And following the completion of chemotherapy, we would reassess the situation. I would hope that his PSA would be down, his performance status would be good. If there are soft tissue elements, I may consider repeating a CT scan after the completion of chemotherapy. I don't always repeat a bone scan because in many cases they can be quite confusing because of issues around bone scan flare and things like that. So once this patient has completed chemotherapy, provided that he is symptomatically well and his PSA is down and things look good, I might only see him every 3 months for a period of time. Now, one of the questions that comes up in a situation like this is local therapy. Now, this is a person at 61 years old who presented to his physician with a primary tumor that was very symptomatic. He was having local urinary tract, lower urinary tract symptoms and even some hematuria. So this is the type of patient who may benefit in a palliative sense from receiving local therapy, which might reduce his risk, for example, of pain or further hematuria. It might reduce his risk of further progression in the prostate, which could lead to urinary retention or even kidney failure. So for those situations, I think a discussion around local therapy is reasonable. There are many situations in oncology where local therapy, even in the face of metastatic disease, may provide some sort of a survival benefit and long-term disease control benefit. We haven't proven that in prostate cancer. There are some studies open. We are participating in a study where we are randomizing patients to local therapy or no local therapy at this point after they've completed the chemotherapy. Outside of a clinical trial, I would only take it on a case-by-case basis, and if the patient were completely asymptomatic and did not have any issues related to the enlargement of the prostate or things like that that could benefit from local therapy, I probably wouldn't offer it to him. But we do await final data on that.